Average people have to pay for other people who can't afford it, and us middle-income workers are paying outrageous amount of money for health care. Every doctor visit we have to pay for, everything we have done, any type of lab work. We pay a lot for the insurance policy that we have, and it's just out of control.
I've looked into policies for individuals that you'd buy, and I don't think I saw a premium under $300 for a parent and a child, and that was with like a $5,000 or $10,000 deductible.
I owned my own business for a while, and the price went up every year for health insurance for my employees. Every year we'd have a different plan, and every year the coverage would go down and the price would go up.
I mean, each insurance is different. If it's a really expensive medication, sometimes the insurances won't even cover it. And it's hard for us to try to tell them that they won't cover it, and then it can be really expensive and they won't want it, so even if they really need it. But I do think there should be, everyone should have access.
I think something should be done about it. I think that health care is just too costly right now, and you can wipe families out with one serious illness and spend the rest of your life trying to pay the bills for being sick.
And so my periods of time in the hospital were becoming longer and longer. At one point I stayed almost an entire month. It came down to just like all those commercials you see on TV. You know, what do you pay? The food bill, the gas bill, or do you buy the medicine that's gonna possibly keep the person alive? Eventually, the car gets repoed, and you find out that they're taking your house too. No one's saving for that day. I mean, you're saving for a rainy day, or you're saving for your retirement. You don't expect all that you've saved to go to medical bills.
A lot of us talk about it every day. All the daycare providers that I know that are in my position, we talk about this every day. We're stressing about this.
Asking them to define the word affordable. Just your name and address, and basically what you're saying is that you think that affordable health care means not more than 5% of your gross income. Health insurance premiums, co-pays.
What we're seeing in the 5% solution is between your share of the premium and your share of the your out-of-pockets, no family should pay more than 5% of their income.
Right now I pay $332 a month for my family premium, and my prescription co-pays are about $300 a month, give or take $15. So total I'm paying close to $650 a month for health care. They asked me 5% solution would cut my health care expenses in half, and that would be very greatly appreciated.
Part of our campaign is going to be to focus on things that the state legislature and the governor can do here in Minnesota to give us relief while we're waiting for national health reform to come along. What we think with the 5% solution campaign is this is something that can be understood, can engage, and can get people fired up, so when they're talking to their legislator, when they're talking to their neighbor, when they're talking to that candidate, say, what are you going to do to make health care affordable to me?
Are you interested?
Oh, yeah.
Name and address.
Okay, definitely I will. We believe we can't solve the healthcare crisis at a single bargaining table. In order to solve the healthcare crisis, we have to do so globally. And to do so, we have to solve the healthcare problem in our state and our nation to protect the healthcare that our members already have. We are hoping that some major reforms take place in healthcare in the next legislative session, but we expect this to be a major political issue. We'll be screening candidates, talking to them about affordability, and then endorsing candidates who are for reforming healthcare in America to make healthcare affordable for all working families. So it's critical that AFSCME members get in a fight for a universal quality healthcare that's affordable for all Americans.
Revolution never come with a warning. Revolution never send you an omen. Revolution never come with a warning.